All right, thank you, Jessica. Well, your little ones will be coming home from trick-or-treating or a Halloween party this Thursday with lots of candy, hopefully. As parents, we should monitor how much of that candy we let them eat at one time. And did you know that some of those candies are worse than others when it comes to tooth health? Local dentist Dr. Kurt Obeck from the Virginia Dental Association is here today to tell us how to keep Halloween from turning into a trip to the dentist. Good morning, doctor.
Good morning, Cheryl.
Good to see you. So when you look at Halloween and trick-or-treating, is it a good thing or a bad thing from a dentist's point of view?
It's a good thing. I mean, it's a tradition that the kids, and I have 4 of them, look forward to every year. So don't want to put a spoil on that, but there's some good choices that can be made.
Absolutely. So when we're looking at candy, I'm sure parents aren't thinking what's the best for the children's teeth when they go out to buy candy, but there are some good choices. Let's talk first about the good choices.
Yeah, well, ironically, chocolate is actually good. It gets on the teeth and it melts away fairly quickly. The dark chocolate's even better because there's several compounds in that help out not only with low blood pressure and antioxidants, but there's actually a compound in dark chocolate that hardens tooth enamel. So anything in moderation is good. So the chocolates get in and off fairly quickly off the teeth. The sticky foods, the sticky candies are the ones we need to worry about.
So I should eat from this side of the table, not this side of the table.
Exactly. We've got some good examples over here of lighter type chocolates, fluffy type things, as well as some dark chocolates, even the Reese's Dark. And then you've got the more sticky ones that adhere to the teeth, get down in the grooves, and they last longer on the teeth. So the sugars are converted into acids, and the acids actually eat away the enamel and cause decay.
Yeah, because we're not really eating our candy and then rushing in and brushing our teeth.
No, that would be ideal, but that's often not practical with the kids. So, you know, if you do it in moderation, or if you pick some times, obviously that first night they're going to be snacking out of their bag the whole night. But when they get home, definitely before they go to bed, when you get something sweet on the teeth, actually about 10 to 20 minutes, 30 minutes max, getting in there, either rinsing the mouth with water, which is great because the kids will often take the snacks to school, or sugarless gum. That's a great way to cleanse the teeth and get some of the sugars off of there. Or ideally brushing within that first 30 minutes.
And making the big difference. What are the long-term effects, or are there any long-term effects of eating too much candy on a regular basis?
Well, there's a whole list of dietary things that can cause some issues, especially with kids with undiagnosed diabetes, high blood sugar, you know, activity. The pure sugars, those are metabolized a lot faster and can have some issues there, but you know, anything in moderation is fine. So,
and as a dentist, I think that probably you talked about some of those other illnesses. Sometimes you're the first line of defense in diagnosing some of those things.
Correct. We'll see several things come through the office, and often we're a family practice, so we see a lot of kids. So we're looking at, dentists in general are looking at a lot of different things that manifest themselves in the oral environment. We can tell a little bit about diet with the amount of decay we'll see in children, as well as fluoridation in the water. So if they're coming from the country and they're in unfluoridated areas, we kind of pick that up. So yeah, we look for a lot of things.
Now, when the kids come home from trick-or-treating, so we need to take the dark chocolate and share some of that for ourselves, and watch some of the gummy candies, because those are the ones that cause the problem. And also, I see you have some hard candies on the no side. Why are hard candies so bad for us?
Well, they tend to stay in the mouth for a long time, and they're pure sugar. And with the youngest kids, you know, you worry about a choking hazard there. But there's some things preventatively that can be done. Most kids were encouraged to come on in, be seen in the dentist around 3 years of age. At age 6 is when they get their first permanent teeth, and they're in the back, and they're molars, and they have really deep grooves. So sealants are often the first line of defense that we'll put on those teeth. And then fluorides. Before the age 6, kids really don't have a good spit mechanism. So the over-the-counter fluorides you'll see in the drugstore and mouth rinses are really not good for 6 and under. Over 6, they're excellent. They get into all the nooks and crannies, and they help protect against decay.
So it's a good time to think about mouth health and teeth health when we're thinking about eating all this candy.
It is. I definitely enjoy the candy.
Dr. Kurt Obeck, thank you so much for joining us today.
Thank you,
Again,
Cheryl.
we'll eat from that side of the table, and that side of the table if we brush
know
our
you
teeth.
will.
Yeah,
Exactly.
we will. Well, thank you so much for joining us here today. We'll be back tomorrow morning from 9 to 10 a.m. And of course, Carrie and I will be back later today for the CBS 6 News at noon. So have a great day. And thank you so much for joining us here on Virginia This Morning. We want to remind you, we're going to have a special Halloween show coming up this Thursday. So watch for that. And we'll be back here tomorrow morning at 9.